We are looking at one unique aspect of health. It's about driving medicine or perhaps driving healthcare with innovation. And this morning, we're looking at telemedicine, the Bastion Health Advantage. And joining me in the studio this morning, I have Dr. Timilehhin Ogunkoya, who is a Group Head Medical Operations 1 for Bastion Health Limited. Nice to have you in the building. Good morning, Dr. Timilehhin.
Good morning, and thank you so much for having me.
All right. So these days, can you imagine talking to a doctor from anywhere in the world? Yes. When you do that, there's no traffic, there's no queues. It's always free of charge and so many things. And that's what Bastion Health HMO is bringing. But Dr. Ogunkoya, what is telemedicine? Let's start from there.
All right. So good morning, Lagos, and thank you so much for having me once again. So I'm sure that we're not aliens to the idea of telemedicine, but it's also important not to take that for granted and be sure that we're able to explain it in as much detail as possible.
All right.
So in very simple terms, right, telemedicine gives you access to a physician virtually. By virtually, we mean that you can put a call through, you can have a video call, all of that supported by the internet and through an app. Right. And you can engage with a physician, get access to care, get a consultation done, and in some way, shape, or form, also ensure that all the other support elements are also present. Needing to run an investigation or even getting medications across to you, all of that is available without you physically accessing a hospital.
So it's not new? Is that what you're saying?
No, absolutely not. Absolutely not.
But not too long.
No. So interestingly, telemedicine predates the COVID era. However, it was that COVID era that sort of brought it to the limelight because, we were confined to our homes and we literally still needed to speak with a doctor from time to time, depending on what the need was. And in such instances, you can then consult virtually and have a conversation with the doctor.
And why do you think Nigerians would need telemedicine?
That's a very, very interesting question. Allow me to use the put a finger down analogy to sort of drive that home.
Okay.
So if you're listening now and even in the room at the moment, I could say put a finger down if you've ever Googled a symptom. I could say put a finger down if you've ever been to the hospital and there was a long queue and you had to wait for hours.
All right.
I could ask that you put a finger down if you have to visit more than one pharmacy in order to get a medication. And I could
very true.
And I could go on and on, right, until you put all the fingers down. But the point I'm making here is this. The need is apparent. We all experience it on a day-to-day basis. It's quite clear that our medical facilities are overburdened. You have people waiting on long queues. You have doctors consulting for very long hours, seeing so many patients. And we're saying that we can lessen that burden by exploiting the opportunity that telemedicine provides. That from the comfort of your homes or your offices, you can literally have a conversation with a physician and get the right direction, right prescription, as the case may be, and not just, be at the mercy of self-diagnosing, because that's what a lot of people sometimes end up doing. I often say that the average Nigerian has a medical degree that he didn't take from the hospital, or rather that he didn't take from school, from the university.
Right.
So we oftentimes self-diagnose, self-medicate, and you can avoid all of that by literally taking advantage of this opportunity to explore telemedicine and be able to consult.
So let's look at it in detail then. So how does it work with Bastion HMO? How do you guys do your telemedicine?
Fantastic. And I'm glad that you asked this part because now that we've highlighted how important telemedicine is, the next point of call would be what the call to action is. So what can I do in terms of being able to access this? For us, it's at the fulcrum of what we do, and I'm saying that because for us the vision really is to make healthcare accessible and affordable as a group in its entirety. So it means that if you want to access that on all the Bastion HMO health plans, you can actually leverage on telemedicine. So it's not an exclusive preserve of just individuals that are able to afford the high-end plans. Every single health plan on the Bastion HMO framework actually gives you access to telemedicine.
So there's a component of telemedicine that is inserted. Is that what you're saying?
Yes, on every single health plan.
Yeah. Are people really taking advantage of that?
That's part of why we're having this conversation. So are we seeing traction? Yes. On a monthly basis, we're seeing close to 1,000 of those consultations happening. But can those numbers increase? Absolutely. Can more and more people take advantage of this opportunity? Most definitely. And that's why we need to continue to shine the light on it. That as much as possible, everybody needs to know that your healthcare access does not start with physically accessing a facility, that from your devices you can still access care.
I'm curious here, Dr. Timilehhin, do we have enough healthcare practitioners that will be able to respond? I mean, if I'm going to put across a telemedicine call or a video, as the case may be, are the doctors readily available?
Fantastic. So the truth is this, and I'm glad that this also came up, because it's also a concern that it's as though we don't even have enough doctors in the hospitals. How much more having enough doctors online or virtually? Right. Now, bear in mind that first and foremost, telemedicine takes away the constraints of transportation. So it means that these physicians don't have to move from place to place, right? From wherever they are situated, they can log on to a platform or a portal that allows them to provide this service. So it means that it's possible, because in a hospital, there's only as many doctors as you can have at one point in time, because maybe you have 4, 5, 6 consulting rooms, and so you can't have more doctors than those rooms can take. But with telemedicine, you aren't bringing people in physically.
So no barriers.
Exactly. So you can have 20, 30, 50 doctors online all at the same time, and you literally can get that consultation done in the quickest time possible without having to wait a long queue that you might have had to wait if you had physically gone to a hospital.
All right, so I need you to give us a clinical scenario and just give us an example of how it works now. So Mama BC is down with a fever, or perhaps Mama BC has woken up with this nagging headache, and she's also feeling some numbness. She's have some kind of temperature, and the next thing is, look, we have to go to the hospital. But the husband says, no, let's do telemedicine. So give us a clinical scenario.
Fantastic. And the interesting part is that Mama BC does not have to consider the cost of fuel when they are looking at this. Is that with telemedicine, they don't have to pay transportation and, go through the hassle of traffic in some of those instances. But very simply, right? For us, the first point of call, and which is what we advocate for everybody that buys a Bastion HMO health plan, is that you download the app. So there is an app that we have for Bastion that you can download. Our telemedicine offering is inculcated into that app. It's already a part of it. So once you open the app and you've registered and you have your policy live on that app, you can literally then consult using that particular platform to engage with a doctor and have a conversation. Shortly after that consultation is done, once a diagnosis has been assessed, and then we've been able to reach what exactly is the conclusion here, then that individual can also then get their medications. And in this case, because it's telehealth and it's a full circle service, you also can have the medication delivered to you as well. So that can also happen, so much so that you don't have to leave the comfort of your homes. Because bear in mind that in some instances, Mama BC in this case might have Baba BC available. But what if Baba BC wasn't available? What if she was home alone and she couldn't just get herself to get transported to the hospital? She literally can not only consult but even get the intervention she needs brought to her within the comfort of her home.
Beautiful. So who can use this telemedicine? Who can use it?
So everybody can.
Everybody can.
And that's really where we need to drive home the message that it's not for just a few, but it's for everyone. It's that as long as, for example, you have a Bastion HMO plan, you literally can access telemedicine. For us, it's a key part of what we're driving, because we believe that if we're really going to make healthcare accessible to as many people as possible and affordable, then one of the ways to do that is to continue to drive the message of telemedicine. All right,
so affordability is very, very key in all of this, because cost really means a lot when we're talking medicine generally. And there's the fear that some will say, well, with telemedicine, I'm likely going to pay more. So, Dr. Ogunkoya, speak to the issue of cost versus value.
Fantastic. And for me, right, I always like to lead that conversation with the value that is available. So it means that whenever you are considering those two parameters, value ultimately would come first. However, for us as individuals, sometimes the overwhelming nature of the cost also comes to mind in some of those instances. But that being said, and through the conversation up until this point, I think we have highlighted time and time again that with telemedicine, you definitely will be spending less. Because I was having a conversation recently, and I was just trying to gauge and assess where an individual had to commute from on a daily basis and things like that, and I'm just picturing in my mind the need to save some of that cost, right? So with telemedicine, because you can have that access from wherever you are present, then it automatically helps to reduce significantly the cost of accessing care. Because let's make no mistake here, in some instances, that accessibility is oftentimes a real challenge. Is that an individual might have to travel quite a distance before they get to their nearest healthcare facility in some of those occasions or instances where that tends to come up. But what we're saying is that with telemedicine, that burden is actually taken away, and then you can, from wherever you are situated, be able to access care.
So there's the concern as well, because telemedicine has a whole range of advantages and benefits. But, when you consult with a doctor physically, Dr. Timilehhin, there is that connection that you have, right? And you feel that you can open up to a doctor. Yeah. I mean, just like somebody in the Catholic faith, you're doing your confession before the Reverend Father. There is that issue of confidentiality, which might never be exposed. But does online telemedicine, will you offer me that?
Fantastic. The simple answer to that question is yes. But I wouldn't make the mistake to assume that we're all there yet. There are still individuals that prefer that physical touch, wherein you can see the doctor. And on telemedicine platforms, you actually can, right? If you have a video call, for example. But some individuals still have a lingering preference to want to be physically present in a hospital whereby the doctor is sitting right across them and things like that.
So you're saying that no major difference?
No, absolutely not. That with telemedicine, you still can. But I'm just saying that there are still people that have a traditional preference for wanting to
see a doctor physically.
Exactly. And that's totally fine, right? With every new idea or with every innovation, it takes time to get adopted, and we're getting there, right? And what we're saying is that with telemedicine, you can have that consultation, you can have that confidentiality, and you still can even see the physician if you choose to.
All right, Dr. Timilehhin, I hope in future the AI will not take over your jobs. All right, so messages are coming here for you. This one says, good morning, Victor. Please, Dr. Timilehhin, what kind of medical professionals are available through Bastion Health platform? Thomas is sending this one in. Okay, I have this call. Hello there.
Hello, good morning, Mr. Victor.
Yes, good morning, Andrew, quickly.
And the telemedical doctor, good morning.
Good morning.
Yeah, I have my fears with this telemedicine.
Why do you say that?
Because like in UK, you have things you can use to assess your vitals at home before you go for telemedicine consultation.
Right.
Which I've experienced. Like in Nigeria, I have my fears because it's not regulated yet. I know it's not regulated yet, but we are using it and it's fine. And two, how do you diagnose someone when you want to do telemedicine? And three, we have, the advantages of the telemedicine, which I know is virtual visit, counseling, medication management, behavioral health services, and so on. But how do you check and do your balance?
Okay.
Thank you. Good morning.
Thank you so much. So, diagnosis is a great concern for Andrew. So, how do you do that?
And I'm glad that these questions are coming up, right? Because it means that the message is getting home and individuals are able to contribute to the conversation. So, thank you so much for calling and asking those questions. So, I think first things first, right? And I think I also mentioned this earlier on in the conversation, is that for telemedicine, it doesn't start and end with the consultation. There are other elements that will be brought into that entire mix. And thankfully, the way it works for us is that it's not just the telemedicine service that we're offering. We're already in partnership with over 2,000 healthcare facilities that can render all the adjunct services. So let's assume that Mama BC finishes her consultation and then the doctor says, I need to do some blood work, right? So in that instance, this could work in multiple ways. It's either that Mama BC is directed to a diagnostic facility not too far from where she's situated,
right,
or that you also have a scenario whereby there are partners that can even come over to take a sample from Mama BC, and that once the results are ready, she then has a follow-up consultation to then say that, oh, from the results that we have seen, Mama BC, you need to be placed on this medications. In the next 30 minutes, the pharmacy will deliver that to you.
There are lots of questions that are coming in here for you, but time is not really our friend. This one says, how do you handle cases where a patient needs further physical examination or hospitalization? I'm sure you've also touched down on that one. This one says, good morning, please. Are insurance companies in Nigeria covering telemedicine services? Oh, yeah. He's sending that one in from Akute. Oh, yeah. Thank you so much. This one says, Doctor, how do you ensure that elderly patients or those not tech savvy can use telemedicine effectively? This is coming in from you, Counselor.
Fantastic.
These are pertinent questions indeed.
Yes, absolutely.
All right, let's see how we can wrap that up in 45 seconds.
So, first of all, are health insurance companies offering it? Absolutely, yes. That's pretty much why I'm here.
Okay.
Is to continue to drive that message that we are at Bastion HMO. Secondly, for elderly individuals who perhaps are not as tech savvy, there's also the option of calling directly. So you could call a line, meaning that you have a phone number that you can put a call across to actually access that care. So if you don't want to go through downloading an app, consulting virtually, you can actually have that phone call conversation with the physician as well.
All right, then. So for those who want to connect with Bastion HMO to tap into this telemedicine, how can they do that quickly?
Fantastic. And for me, this is a critical call to action, is that right now, having listened to this conversation, you can literally go straight to our website. That's www.bastionhmo.com. www.bastionhmo. Bastion is spelled Bastion, bastionhmo.com, and you will be able to access much more information.
Okay, then we'll leave it at that for now. It's nice having you in the building, Dr. Timilehhin.
Thank you so much for having me.
All right, he's Dr. Timilehhin Ogunkoya. Of course, he's head of the Group of Medical Operations 1 for Bastion HMO. Okay, then, a brief break. When we return, we'll do our birthdays before we switch gears to transport, trends, and perspectives.